Welcome to the podcast of the Center of Translational Medicine, Szabolcs University. My guest today is Szabolcs Gaál. Welcome.
Thank you for the opportunity.
Szabolcs, you are an emergency physician, am I right?
Yes, that's true. I'm a specialist in emergency medicine since 2020. So right in the middle of COVID, I got my degree in emergency medicine. At the best time, yes, to start. Actually, I started my training in 2015, so it was basically the end of it. And I work since 2015 at the Szabolcs University's emergency department, which became a department of its own right 2 years ago.
And how did you decide to become an emergency physician?
It was a long story. During the university, I had no idea what to do. I was interested in a lot of fields, and I figured out that I could not work in a regular hospital environment. So I started the general practice training back then after university, because I wanted to see the patients as a whole and not just some part of them. So I started that training, and during the training we have to do 3-month emergency rotation. I did it with my colleagues at a different hospital, because Szabolcs University did not have any place to do the training. And I just realized that I really like the everyday life of an emergency physician. I like that every case is different, every day is different. We have to work with patients from lots of different background and lots of different problems. We have to treat them as whole. We have to be conscious about every small details about their body, about their health. So I like this holistic background of emergency care. So I transitioned back then. When I was invited to the team of the emergency department of Szabolcs University, which was a non-existent thing back then. So after the 3-month training, they invited me to work with them, help them to build a department at the Szabolcs University. And after a month of really hard thinking and measuring every costs and benefits, I started the transition towards emergency medicine.
Yeah, but this is a very challenging job, because you have to make decisions. Much depends on your decisions. Is it stressful mentally for you to be an emergency physician?
I think every field of medicine can be stressful. But what is different in emergency medicine, that you have to make decisions really fast. So you don't have the time sometimes to think it through, to check every possible details about your decisions. You just have to call for one decision. It can be challenging, and especially during surge capacity time, when, for example, during COVID, when we had to treat 120 patients at the same time. It is challenging, but I think I got used to the workload and the mechanisms behind and the mechanisms of decision making at the emergency care. So I love my job. Sometimes, yeah, it can be challenging, of course, but
and what is
I still like that.
And what is the key to make the best decisions under pressure? What is your strategy to be sure that you made the best available decision?
The first thing that you cannot be sure that you're gonna make a good decision. First, you have to have a broad knowledge. So you have to have a stable ground where you can build your decision onto. And this with this for this you can and you have to do your training well, and you have to keep your knowledge updated and up to date all the time. So for that, I listen to a lot of podcasts. I read a lot of literature to know that my knowledge is there where it has to be, and whenever I make a decision and under pressure, under time pressure, or in the critical situation, I try to use that background. Of course, I try to use all the available information from the patient, be it as the history or the vital parameters or the results of any kind of tests, and just go for one, because making a decision in those situations is better than sometimes compared to just waiting. Because if you don't make a decision and you wait and you hope that something will turn out, you will never know if the patient will deteriorate or not. But if you make a decision, be it as wrong or right, you will see the results of that decision. It's not immediately, but pretty soon. And based on what you see, you will be able to judge your decision
and make new decisions.
Yes. So it's not just the decision that you have to make, but you also has to stand at the bedside of the patient to see the result of your decision and make a new one. So my strategy is to collect as much information as I can at the shortest period of time, make a decision, and check back on that decision. Is it made the situation better or worse?
Yeah, but for me, it seems that every case is different. How can you rely on scientific or official guidelines in your work if all the cases are different?
Yes, it's true that all the cases are different, but there are some. So there are commonalities between them. There are some patterns that you can realize in the course of the patient, and the guidelines and the literature is about those patterns. Of course, as we know that this is just the middle of the Gaussian curve, so these guidelines may be true for the 80% of the patients. That's why you have to make a decision probably based on that. That's going to be the first choice that you're going to make. And after that, you have to check if the patient falls into that area which these guidelines are based upon. And if they are non-respondent for that treatment, or they are or their response is just something really, really different, you have to stop there, ask yourself, what am I missing? Is it really working? Do I have to step out of the box? And sometimes the answer is yes. Sometimes the answer is that I missed something, and it's going to be another pattern which another guideline will describe what to do with them. So it's an always thinking, always conscious situations where you just have to rely on your knowledge. You have to rely on the data that you can collect from the patient, and you have to rely on your colleagues as well, because sometimes they will see something that you don't see. So we have to be open for teamwork, and that is special about emergency medicine, because I think none of the other specialties rely that much on the nurses and the other colleagues as much as emergency physicians do, because the nurses are seeing a lot of things that I don't see, and if that information is lost, then I can't make. I can put together my puzzle about the patient as clearly as I want, if I miss those pieces that are coming from, for example, the nurses or the other staff members.
So you believe in teamwork?
Yes, of course. So in emergency medicine, it's inevitable to work in teams. I cannot do a lot of things what our nurses can do. And of course, they cannot do a lot of things that I can do. So if we put everything together, what we have, it's not going to be the sum of our abilities, but it's going to be synergistic. So it's going to multiply the possibilities that we can have.
Most medical doctors are users of clinical evidences or guidelines, but you, as a PhD student here, are not only using but also generating evidences. So this is the other side of the same coin, because now you are not only a user but also a creator of evidences. Do you think it is useful to take part in both roles?
Yes, I think it is, because as a clinician, I know that no guideline can be perfect, and they are not they don't describe all of our patients, and there are a lot of open questions that needs an answer, what to do with them. And I can use my best judgment based on my prior knowledge, but it won't be as good as the decision which is based on not just my previous knowledge, but based on good evidence. So my goal is to find those gaps in the knowledge that we have about the treatment of emergency patients and try to fill them up with some answers, which might be helpful not just for me, but for everybody else who works with acute cases.
What are your questions for which we are looking for? Sorry. So what are the questions for what you are looking for answers?
If I want to give you a general answer, is how we can treat our patients better, of course, which is really just a broad one.
This is the most important question.
That's of course that's the basis, and because the scope is just too huge, we cannot answer that just step by step. So now I have a project on finding out what is the best score system to use in patients who present themselves with chest pain to the emergency department. And I also have a special interest in geriatric patients. And I want to give them the best treatment that they can have. My question is that how we can reduce the number of unplanned returns to the emergency departments, because we know that the more a geriatric patient present themselves to a hospital environment, the more chance they have to get an infection. And for example, and also it's not really good for them to just travel around the world. It can increase the likelihood of acute delirium, especially at the even older population. So there are lots of risks is introduced by each and every visit they have in the hospital environment. I want to reduce that. So
you are working on searching for factors that have influence on the return to.
Yes, basically that is that's one thing. So first, I want to see what happened with them in the past, and based on what I see, I try to influence the decisions made with geriatric patients at the emergency department, and see how it works out. How is it? Decreases the number of the unplanned returns or not. So trying to find out the factors and trying to control them. And after that, I just want to see if it works or not. At our department, if it works there, maybe we can just open up the scope for other departments as well, because each and every patient population is different.
And these projects bring you closer to gaining the PhD title, because I think this is one of your goals.
Yeah, basically, having a title is a nice thing. My goal is really to provide better care for my patients. PhD is going to be, I think, just one tool, which will open up some doors for me. For example, at international levels, I can work better with other colleagues if I understand what they talk about and how the questions are answered at the scientific level. So it's really just a tool, not a goal, I think.
Yeah, one of the tools, but there are some other tools as well. And what do you think about the courses of the Center of Translational Medicine? Are these useful to be a better doctor, or which courses do you think were most useful for you to improve your skills?
To improve my clinical skills, I think it's not. I would not say that they are not useful. They are useful in a different way. So these courses, for me at least, not just give a guide to how to basically be a scientist, but also how to think critically about questions, how to approach them from different perspectives. And this is what I think is the most helpful for me as a clinician. On the other hand, of course, by attending to these courses, I understand the science and those articles that I read much better. I can have a much better critical appraisal about each and every result that I read, so I can make better decisions based on the currently available evidence better. So that's how these courses help me.
Did your attitude change somehow after joining CTM, either as a medical doctor or as a person who is dealing with science? So did anything change with your attitude?
It's hard to say from the inside, but I think yes. So as a clinician, applying the results of the current literature, I think yes, because I now can choose much better and I think wiser the evidence that I accept and the results that I accept with some second thoughts, or the results that I just think are not really useful at the moment. So that's one part. And as a scientist, I'm not consider myself as a scientist yet. So a lot of things changed. But what I realized that I liked working on these questions, and I like this kind of work, which is really different compared to what I used to do in the past 10 years. So I try to focus on these questions a bit more. But of course, since I have a lot of other roles, it's sometimes really hard.
Okay, so I wish you success for your professional life, for your PhD studies, and thank you for accepting our invitations, and thank you for being the guest of our podcast.
Thank you very much.
Thank you.